taking on this wonderful, courageous, really time-consuming research that she did. Here you go. Here you go, Judy.
Hi, I'm Judy Marlow, Ratway, Executive Director of Public Relations for ReneMarie's Language of Love Foundation and Telethon. And my spotlight this afternoon is on spasticity. But before I get started, I wanted to just review that a stroke occurs every 40 seconds. And there are 800,000 strokes in the United States every year. And it's very important that the public knows the signs. And there are many signs. The ones that come to mind immediately when we say fast are the face, arm, speech, and time. Time means you must call 911 within the first 3 hours to get the best results. But I want you to know that anybody could have a stroke. And a stroke could be somebody could have a stroke that is an unborn baby, through childhood, adulthood, and senior citizens. So it's not one age group that has a stroke. Anybody could have it. And the signs that you should be looking out for and alert for are an uneven smile or a face that's drooping, arms that cannot be extended properly, arm weakness, slurred or unrecognizable speech, speech difficulties, sudden numbness or weakness in the legs, sudden confusion or trouble understanding what is being said, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, severe headache with an unknown cause, laughing or crying for no apparent reason, endlessly laughing or crying, and swollen ankles. And time, as I said, is of the essence. You must call 911. Don't think about it, just call. After a stroke, there's a condition called spasticity. And that is what I'm going to highlight this afternoon in this segment. Spasticity is an abnormal increase in muscle tone. It may be associated with involuntary muscle spasm, sustained muscle contractures, and exaggerated deep tendon reflexes that make movement difficult or uncontrollable. Spastic muscles are resistant to normal stretching. Spasticity may increase anxiety, emotions, pain. It may worsen with movement or involved muscles. Commonly affected are the legs and the arms. Spasticity can affect any part of the body, including the trunk, neck, eyelids, face, or vocal cords. After a stroke, damage to the brain can block messages between the muscle and the brain, causing arm and leg muscles to cramp or spasm like a Charlie horse. This will limit your coordination in major muscle groups, causing painful muscle spasms. These spasms can produce a tight fist, a bent elbow, which could become frozen in time, an arm pressed against the chest, stiff knee, pointed foot, stiffness in the arms, fingers, knees, or legs. The symptoms are increased muscle tone over active reflexes. That's what happens when you have the symptoms. Involuntary movements, which may include spasms and pain. Decreased functional abilities and delayed motor development. Spasticity is one of the top 3 post-stroke conditions among stroke survivors. A stroke survivor suffering with spasticity increases their likelihood of living in a nursing home versus stroke survivors without, because of the difficulty of attending to activities of daily living. Spasticity creates difficulty with care and hygiene, abnormal posture, contracture of the bone and joint deformities, and sometimes permanent contracture of muscles and tendons. There's no cure. Treatment will be a mixture of therapies and medication. The treatment options are putting the affected limb in a brace, helping with gentle stretching of the tight muscles, frequent movement and repositioning of the body parts. Range of motion exercises are very important. There are oral medications available to treat the effects of spasticity. There's ITB therapy, which is a programmable, battery-powered medical device that stores and delivers medication to treat some of the symptoms, can't talk now, of severe spasticity. Surgery on the muscles or tendons and joints. They may block pain and restore the movement. Injections block the chemical that makes muscles tight. And I chose this topic, as ReneMarie mentioned, because my dad had a stroke. And in the beginning, when he was in the hospital, I went and I exercised his arm, his paralyzed arm, and I seemed to be getting flexibility with it. And then they put it in a brace, and he was locked in this position. What I didn't know is probably without the brace, it would have been locked against his chest. So although I was uncomfortable that it was in a brace, and I felt that it was robbing me of the ability to exercise it, I did exercise his leg. And this is why this is important, and I feel that everybody should know about it.
Well, that's really very interesting. Thank you so much for, all that information. When I
know that